So our next panel will help us understand some basics about mental and behavioral health. The moderator for this session is Steve Rush. Steve is a member of the Roundtable, a licensed psychologist and director of the UnitedHealth Group Health Literacy Innovations Program. This program incorporates health literacy and plain language best practice into UnitedHealth Group programs and services. You can read more about Steve and all the other speakers in our handouts. I'm also going to ask, when you do speak from the either the audience or the roundtable, please come just a little closer to the microphone. I was told that it's a little difficult for them to record if you don't do that, so please do that. Steve, will I ask you please to introduce these speakers?
Yes, thanks, Bernie, and good morning. I'm going to introduce all three of our panelists, and each one will give the presentation, and I'm asking you to hold your questions until they've all finished. Our first speaker is Wilson Compton, and he will help us define the concepts of mental health and behavioral health and define the difference. It's been real confusing at times for lots of people. Dr. Compton is the Deputy Director of the National Institute on Drug Abuse, and that's called NIDA. And NIDA supports most of the world's research on health aspects of drug abuse and addiction and related to preventing drug abuse, treating addiction, and addressing serious health consequences of drug abuse, including related HIV, AIDS, and other conditions. And Dr. Steffens, our second speaker, will explore the ways in which cognitive burden impacts health communications, particularly for those with mental or behavioral health communication, particularly for those with mental or behavioral health issues. And Dr. Steffens is a professor and chair of psychiatry at the University of Connecticut Health Center, where he has expanded clinical services for older adults and has developed a multidisciplinary research program on depression and cognitive impairment. And our third panelist is Michael Wolfe, who will discuss approaches, including health literacy approaches, to use to address issues associated with cognitive burden. And Dr. Wolfe is a professor and associate vice chair for research in the Department of Medicine at the Feinberg School of Medicine at Northwestern University. He has extensively studied cognitive, psychosocial, and health system determinants of health, specifically in the area of health literacy and health communications research. And again, please hold your questions until all speakers have finished. And Dr. Compton, would you please begin?